I hope you're all happy to be here with us today at the 42nd Annual Scientific KDA Conference, the 42nd, since 1960 when we started. I believe you're all settling in and more still coming in, and I can see the hall is fully packed. But I know by tomorrow we'll be having enough of us in here. Karibuni sana. So distinguished guests, Dr. Amoth, Dr. Mundia, Professor Were, colleagues, ladies and gentlemen, good afternoon and a very warm welcome to the KDA Dental Annual Scientific Conference and Exhibition. It gives me immense pleasure on behalf of the KDA National Governing Council to extend our heartfelt greetings to all of you. Your presence here is a testament to the collective commitment that you have all put in the profession and what we aspire to serve our people with. This year's theme, Advancing Excellence in Dentistry, Navigating Ethical, Technical, Legal, and Professional Frontiers, captures the dynamic transformation our profession is undergoing. A lot is happening in our space, and a lot you have embraced, I've seen. We live in a time of great innovation, where technology, where ethics and law intersect. And that is what we're called upon to work as practitioners. How we relate with our patients and how we sustain professional integrity matters. And that's why we're called into this profession. Over the next few days, we will engage in robust scientific discussions where we shall discuss groundbreaking research and outputs that are moving to the community. We'll also reflect deeply on the ethical and legal frameworks that must underpin our work, ensuring that progress is not only measured in technology and technique, but in trust, compassion, and professionalism. As we convene here, let us use this as a conference, not only to learn, but to also connect, because that is very important. As professionals, when you are ever in the clinic, sometimes we move out and we're left out there. So it's always good to always come back and network and engage with persons in the same community, because that professional development is needed for our growth. Together, we can continue to position dentistry in Kenya, and as a leader in clinical excellence, ethics, and service to humanity. Once again, I want to welcome you all. Welcome to the KDA Annual Scientific Conference. May it be inspiring, may it be enlightening, and may it be memorable for all of us. Thank you. So we are joined by our partners, as many as we do, and today we are privileged to have our other branch of the doctors' networks, and that is the Kenya Medical Practitioners, Pharmacists, and Dentists Union representation, coming to speak to us, give us remarks as to what is happening in the space and what we need to be looking out for in the profession. At this juncture, I want to invite Dr. Abidan Mwachi to give us a few remarks before we move on to the next program. Thank you.
Thank you, Mr. President, and fellow colleagues. The Director General Health, Ministry of Health, Chairperson, the Medical Board. Allow me to ride on the protocol already established in the interest of time. My name is Dr. Abi Mwachi, the Chairperson of KMPDU. And good afternoon once again. Guardians of smiles and sculptors of molars. I come in peace, not with a drill, but with a prescription for solidarity. As Chairman KMPDU, I promise not to extract anything today. Perhaps maybe a little attention and collaboration from KDA, because there's a lot that's happening. I was told that dentists are experts at filling gaps. So I figured out I'd come and fill one within the national conversation. The elephant in the room is so obvious to us that if we are going to let community oral health workers do extractions, fillings, and root canals, then surely the next logical step is to let theater technicians perform appendectomies. After all, they have seen their hospital from the inside, and they know that all bleeding stops. It may stop when the patient has died, but it eventually stops. And while at it, let the guy who sells roasted maize on the corner do your next laparoscopy. He got fire, he got focus, but above it all, he's got a flexible schedule. You wouldn't let someone with a YouTube certificate fix your brakes, so why let them fix your bites? This is an inherent error that came from us, and it needs to be admonished, corrected, and never again to happen. Now, closer home to what unionism is about, basic salary arrears. From 2017 to 2024, basic salary arrears stood as a quiet ledger of justice, but also a loud statement of our commitment. The KMPDU CBA remains the only one honored in the history of this country. That is not luck. It is legacy. Your silent mamas gave us the loud roar that made us go for the kill. Now, let me speak more plainly. The 2024-2025 arrears will be in situ before Christmas. Consider it done. Our meeting with SRC yesterday also sealed another big challenge that we had, that is converting the basic salary into, what you're getting as arrears into the basic salary. By all intents and purposes, you are going to have a good Christmas. Not just with cheer, but with dignity moving forward. Yes, we faced resistance. They said we overpaid. We reminded them that we're within the civil servant scheme, governed by a codified progression. So the real issue was that we need to get out of the stream. There was no code for us, and that we needed recognition of the clinical grind that's different from the other political, social grinds. The union, through the union fire and frontline sacrifice from each one and every one of us, we managed to get the new codes akin to a different structure system that can be likened to the judiciary and the military. And we insisted, and perhaps Mundia will understand this, fiat justitia, ruat calam. That is to mean that let justice be done, even if the skies would fall. Because our members are ruthless in their service, and most importantly, our members are deserving. This is not just a win, it's a reminder that when doctors organize, the system listens, and that when KMPDU speaks, the country recalibrates. That note, Merry Christmas in advance, comrades. Your value is no longer pending. Now, we are also aware of the many matters that are pending within the counties. We are aware that there's a big elephant about Kiambu. It is work in progress, as you can see. And there is nothing that will let us lift our foot off the gas pedal in the Kiambu matter until dignity is served to the doctors in Kiambu. On Monday, we were there, and we'd like to thank the hundreds of you who turned up to show that impunity has no face in the current dispensation of this country. And that what pen puts into paper, that paper needs to be honored, and not just honored, but implemented. You shall see. Our word is our bond. It will get implemented. So we are also noting quite clearly that across board, dentists are still waiting to be employed. We were having these musings with Dr. Mundia when we visited MTRH, and it's a continuous conversation that whenever counties do advertise, they list very few number of dentists sometimes, and perhaps many times not at all. This goes to pharmacists and dentists. I'm glad that we work very closely with the Director General and the ministry at large to address these staffing gaps, as to tell the political class and its elites that the levels are not to be determined by the number of beds that exist in the brick and mortar, but by the appropriate human resource for health personnel that are employed to offer services, because medicine is a service industry. It is not like a soap manufacturing industry where machines will do the work. And when you see us dance tango with government, just know this is not out of love, and I hope that love will be there so that we foster better things. We do it out of necessity, and because just choreographing some anger and feuds just to portray an image of macho barely helps. And you know, we are very well endowed when it comes to street shouting and marching. And also in alignment with what we advised by a former US president, speak softly but carry a very big stick. I will be remiss if I don't mention that we are close to our terms and we are going to the silly season, what is called next year. But for us, it's a season of accountability. On behalf of my colleagues who might make it to come at the closing ceremony, the Secretary General and the entire team, Dr. Davi, Dr. Mercy Nabwire, and I have my deputy here, Dr. Mundia, who I still want to retain as a deputy. I started with Dr. Tim Theory, who was my running mate throughout the campaign period, but it did not work. I ask you to look at us with kind eyes moving forward, not blindly, but just honest reflection. Let that moment, when it comes, be a moment of truth. There'll be noise, there'll be promises, plenty of choreography, but you've seen what real work looks like. You've felt the impact of systems built, arrears resolved, structures that actually work. We have fire under our bellies, not just passion, but purpose. We've turned murmurs into movements, frustrations into frameworks. So when the time comes for continuity, vote for courage. Vote for the team that didn't just speak, but delivered. Let your ballot not reflect hope. Let it reflect memory. In ending, so let's keep the smiles real, our drills sharp, and the policy conversations even sharper. After all, we are not just filling cavities, we are filling gaps in our healthcare system. Dentists, medical officers, and pharmacists, we are not just colleagues, we are co-architects of public trust in the healthcare system. Let's keep building together with precision, purpose, and most appropriately to most of you, with a little bit of bite. And so for the union too. Thank you very much and have a very pleasant and joyous conference. Asanteni sana.
Thank you, Dr. Abidan Mwachi, my former classmate. I would now want to move forward. I'm going to invite Prof. Were, the chair of the KMPDC, so that he can also talk to us. Karibu sana, Prof.
Good afternoon. This is the first audience of practitioners for me to address since becoming chair of the council. So I'll go through the protocol. Of course, the DG, whom I had the privilege of teaching, he sat in my classroom while I was standing, as many others did. President, there's a time, I don't know when you were there, there's a time I was principal of the college, so I was teaching everywhere, including pharmacy and dental sciences. So I can pride upon being participant in the teaching in the University of Nairobi at least. I come here to share with you your hopes and my hopes. I'm saying your hopes and mine because before I came here, a little message was sent to me with your hopes. Let me address your hopes to begin with as we start this wonderful conference. Number one, you are concerned about the dental cadres, registration, licensure, and all that. Those beyond, outside of the dental science as we know it. The others who come with different qualifications. the oral health, community oral health officers, and then of course the dental technicians. And I don't know who else are there that we don't know yet, because I've had the mention of the word quacks in the remarks I received. So there may be others that we don't. I can only tell you one thing. The cabinet secretary is really warmed up to the fact that nobody should be hung around with the training that we do not know, and nobody should be practicing outside what it is that they should be practicing. And my memory and the times I've sat with him in my 2.5 months in office, he's keen on regulating that properly. In fact, beyond that, we are expecting more, even on the side of the medical side, to be part of what we regulate. And that includes, I think we have the audiologies, we have ophthalmology, there are very many other subgroups. And in the council, we feel strongly that the medical and the dental are the apex of care. And therefore, it may not be harmful for us to keep an eye on those whose faults and problems end up in the hands of the two groups. In fact, in my last council meeting, I was very impressed with one of the members, who is a representative of the human rights group. He said, actually, that is not necessarily a bad thing, but we have to regulate and control it. I warmed up to that, and there's more than that. They are going to have to join the council. I think the political thinking, the moral thinking is that many of them are not governed. There's no organization that looks after what physiotherapists do, occupational therapists, the audiologists I'm talking about, even the dental technicians who are pretty busy in practice, they are not regulated. And they cannot stay that way in an enlightened Kenya which wants to move. Having said that, the next point that worried you, the scope of practice to distinguish. And again, that's something that the council can't run away from. It's vital. We have the two scopes that are clearly known for the doctor and the dentist. And then all those that come to do work that is, in theory, apex to ourselves, need to have a scope of practice, which is clearly delineating. And again, fortunately, I've come into this position at a time when the leadership in the ministry is strong about that. Scopes must be written. I know there's been wars around the oral health, and the speaker just before me did imply that he's aware of those wars. There was the saga between a scope that was put on the website, removed, and be put again. And I think I've seen another there. And that was the thinking of this current council. We don't have a good scope, but there's a scope that has been put forward by the Ministry of Health, which can hang on until you have a proper one that is agreed. The point that we had in mind is that if we leave it open without, that's only allow them to do implants. And there's nobody to stop them, because there's nothing the public knows that they should not do. So, but we're going to have a proper one, and the cabinet secretary is keen on us looking at all of them, including mine. The scope of practice of a neonatologist who is 67-year-old should be different from the one of the young man whom he's teaching. But basically, you're looking at it in a broader sense. The story of listing, I hear you, but there are two laws of listing. One is of the people or groups that shall be under the council. And I agree, it's just that it needs to go through the proper processes, that of lists of the doctors, lists of the dentists, lists of the cohorts, lists of the technicians. That makes sense. The bit that I'll divert away from for now, until the politics of the day can help us, the listing of facilities. That is likely to be removed from the council. The only adjustment you're praying for, that we need to have an idea of where all the people we sort of oversight are training. So that has been my prayer to the system. But that's going to move to another organization. I think it's a gone case. The DG is aware. And I'm not sure it's a bad thing. I'm actually happy in a way. It's thank God there's no question time for you to me. I can tell you my views, that I'm happy to concentrate on what matters in my side of things, our practice, and steer away from all this harassment of whether a facility has good enough toilets to continue being level 3. I'm quite okay with that bit. I'll have to convince all of you somehow, slowly. I had a conversation with the association leaderships, all of them, recently, and we're sort of thinking that's the direction to take. The issue of advertisements, once you become regulated by the council, the laws of advertising services are clear. Quacks, are there. They're not governed by me. So my trouble is the DG and the CS has to use a different arm of government to deal with the quacks. We can't catch them all. But the advertisement rules that are there even before we became in council, when we were, even the ones that are governed just by the primary ethics and the oath that we take are there. And we shall do our best to keep that in line. Now you have come to matters. I wish I had my CEO here to answer those ones. Delays in complaint handling at KMPDC, those are found there, and those will have to end. I'm not one that is happy to find things and leave them as they are. When people come to my office, complain about a delay, I listen and hand over to the proper office. I think it will be wrong for me to pretend that they haven't been there. They have been because you are the consumer. You are the one whom things are harassing. So my direction is to do my best to make sure we have. I've asked my CEO to develop a turnaround time for each of those things. If it's past, now a realistic one. If this needs to be 2 weeks, it should be 2 weeks. If it takes 3 weeks, let there be a reason that justified that 3 weeks. Now, I've told you that I'll steer away from the facility registration, but you are saying facilities on issuance of application for the last 11 months. Those are my headache. Those that have been there for 11 months are not done until rules change. I hear this as a matter. My CEO is represented here and is listening. Those are not even things that should be happening, so we'll do our best to do that. I'm not going to give any excuses. They should be done. I know there's a gallow of these excuses, financial restrictions and that, but that should be done. Now, in my few minutes, I had my own 7 agendas, but I'll reduce them to 2. This was the 1, 2. Number 1, my dream. I know we are going to come out of here after 3 days with 50 CPD points, or a bit more. Agree? And next year, I'll be signing that each one of you have qualified to be relicensed to continue, Dr. Dienya, to continue implanting, and TJ, not TJ, I'm seeing my only age mate in the audience now, if he has been hiding his age, he should tell, is going to continue practicing the high-end radiology on the basis of this. This needs to continue, but it's my prayer, for which I know the associations may fire me, and I'll accept the firing with pride, that I need something else to be happy that I'm licensing Dienya to continue implanting. And I'm not going to originate it because I don't know. So I've empowered the associations when they came to see me to give me a way forward of catching up with the actual things that we do in addition. You will develop it. We shall refine it. And it's not going to happen next year, of course. With the time we have now, is develop something to trial it in the course of next year and maybe the following year. It's going to be something. I think, personally, when I sign my license, which is based on the fact that I go to Hurlingham Children's Clinic, and I last saw a patient there in 2013. I since left that one. The only places I work are in Kenyatta during my teaching, and these days in Bagathi, not even many of the private hospitals. So if that is not captured in what I'm signing, then the chair of the council is cheating. I'll begin with myself. I need to provide evidence that I am still practicing some sort of neonatology somewhere. And that evidence cannot just come from my word of mouth. It needs to come from somewhere. But I want the organizations to tell me how to ensure that this person is actually doing these root canals. I'm not worried about numbers, but there must be evidence that you are doing it. The second, I'll skip the third one because I'm almost there, is some dream I've been having, and this is, I want you to recognize that the council actually belongs to you. You are the owners of the council. I'm a servant of the council, and Mike here and my CEO, Dr. Kariuki, are the secretariat of that council. We always have some of these delays we are receiving here are related to funding. There's a time recently when we are threatened for declassification, which removes us from a state corporation to something else, and we're battling. The DG will make sure that we are not dropped down. The point is that part of my dream is looking at sustainability beyond the government grants. How else can we? I threw that challenge to my colleagues, and I hold it. And if this thing is ours, it's good for us. We want the council to be strong enough to keep an eye on those, including those quacks, to make sure they're not there. We've got to work on having sure it's well funded, to some extent, helping what the government is doing so that you're free to. Part of the 11-month delays related, we haven't got the funding to be able to go to Busia. That time I went home, they're almost closing the door for me. I come from Busia. I came back with a long list of things that I haven't done. I didn't say I was not there. I accepted that I haven't done. Once you take an office, there's no saying that others failed before me. It's just you who did. That is my final conversation. This is to all associations that, at least the main ones. When things change and have all these other affiliates, the next thing they'll be demanding that they want representation in the council. Just like the cohorts came and they got a representation. I'll leave it there. I'll have to navigate it in a way different. I'm not disclosing it yet, but I'll share with you. You are the consumers of it. I'm sure you sense it. When the dental technicians come, they will want to say that now that the cohorts who are given a slot, of course, we can't have a council according to our rules of one physiotherapist, one occupational therapist, one radiographer, all those that come in being governed. So in other words, I will be working with the DG to realign how else we do this. And so if you hear me asking you to help, you will understand me. Thank you.
Thank you very much, Prof. Were, and I can assure you that dentists are behind you to try and support you so that we get good regulation so that our patients are able to get the best that we can. So through our representatives in KDA, we shall continue to engage you. And so far, for the 2.5 months that you've been there, I think dentists are happy. So keep up that. I would want now to welcome, I don't know, protocol might not allow, but allow me because I know the DG has a plane to catch. I welcome him to make his remarks and declare the conference officially open. Karibu sana, DG.
Association, Dr. Mundia, and your executive committee, my colleague, Dr. Penny Mwange from the ministry, Mwalimu and chair of our council, Professor Were, the CEO of Kenya Health Federation, Dr. Theuri, and there's a nexus between me, Were, Professor Were, and Theuri because we are all council members at KMPDC. The chair of KMPDU, please let's have a nice Christmas this time. You're not threatening to issue anything. Distinguished delegates, ladies and gentlemen, good afternoon. May we be upstanding to observe a minute silence in honor of our departed former Prime Minister, Honorable Raila Amolo Odinga. Thank you. Let's take our seats. Let me start by conveying the apology of the Cabinet Secretary for Health, Honour Duale, who ought to have officiated this function, but because of exigencies of work, had planned to attend a plenary session at the National Assembly this afternoon, but which has since been cancelled because of the events that have occurred in the past few hours. Honorable Waziri conveys his support, his appreciation of the work that you do, and stands with all the dental practitioners as we strive to be able to deliver better oral health for our people. And as a testament to that, we had a meeting with your president and the executive team maybe about 1.5 or 2 months ago in the ministry, where we dedicated close to 1.5 hours of intense discussions to be able to address issues that affect dental health practitioners in this country. And you provided very robust suggestions that will go a long way in improving the health of our people. Allow me to read his speech, then I'll make 1 or 2 remarks. It is my privilege to address the 42nd Annual Scientific Conference and Exhibition of the Kenya Dental Association. The theme of this year's gathering, Advancing Excellence in Dentistry, Navigating Ethical, Technical, Legal, and Professional Frontiers, resonates well with our nation's pursuit of quality, equity, and leadership in healthcare. Allow me to commend the Kenya Dental Association for its unwavering commitment to professionalism, ethical conduct, and innovation in advancing oral health in Kenya. This conference brings together a dynamic mix of practitioners, academia, researchers, and industry leaders, reflecting the multidisciplinary strength of Kenya's dental community. Our National Oral Health Policy 2022-2030, together with our strategic plan, affirms our intention to fully integrate oral health within the Universal Health Coverage Framework. Oral health is not an isolated issue. It is tightly linked to nutrition, maternal child health, chronic disease prevention, and community well-being. The Ministry of Health is firmly committed to building resilient oral health systems by strengthening infrastructure, improving human resource capacity, embracing digital transformation, and investing in leadership at county and referral levels. This is our pathway to ensuring timely, affordable, and high-quality dental care for every Kenyan. This gathering provides a critical platform to engage with emerging opportunities and also address our urgent challenges in dental practice, particularly around technology and innovation. Kenya is positioning itself to harness global advancements while staying responsive to local needs. Our leadership in medical innovation was recently affirmed when a multidisciplinary team at Kenyatta National Hospital, in partnership with the University of Nairobi, performed a pioneering 9-hour facial reconstruction surgery on a 7-year-old boy, Ian Baraka. This historic achievement made possible through advanced digital modeling and surgical innovation, not only restored function and form, but also showcased Kenya's growing capacity in complex, compassionate, and digitally enabled care. As we embrace innovation, ethics and professionalism must remain our North Star. All practitioners have a responsibility, individually and collectively, to uphold continuous learning, uphold strict adherence to regulatory procedures, and uphold the highest degree of patient trust. The ministry is taking bold steps, including the development of the Digital Health Regulations, the Quality of Healthcare and Patient Safety Bill 2025 that is before Senate, and the new policies on artificial intelligence in health. We are also aligning oral health training with national health workforce needs through clarifying and enforcing scopes of practice. We are ensuring every practitioner delivers care within their accredited competencies. And for this, there's no turning back. I know I've personally had to bear backlash from some of our colleagues. You must only practice what you are trained to do. And what you are trained to do must be based on that curriculum that not only delivers theoretical lectures, but the necessary contact hours to be able to ensure that you are competent once you go to the field. I am glad that the team chaired by Professor Kokwaro of Strathmore University, who is the technical lead in this assignment, have done a wonderful job, and next week they are retreating to be able to write their final report. With that report, we will not have people pretending to be able to do things that they were not trained to do. And I call upon you to be able to support us in that process, because sometimes as public servants we face difficulty. There are certain things that we cannot be able to articulate in public limelight because of the nature of the office. But you as an association with all these members, this hall is full of wonderful professionals. You have a powerful voice that you can be able to exercise to ensure that you support us when we do the right thing. But also call us, make us accountable in case we lose direction, so that you can be able to bring us to order. So for scopes of practice, the professor is here. We agreed that the one that was there, we pull it down, but this one that had been there, launched by the ministry, that stays in the interim so that there's no gap. But as this team finalizes this work, then we can be able to move forward as a country that is progressive and also embraces change and innovation. This conference inclusion of diverse research perspectives is commendable. Initiatives like the launch of the East African Dental Journal and Public Health Symposia reaffirm our commitment to evidence-based, culturally responsive, and regionally relevant health policy. As we roll out universal health coverage under the Social Health Authority, we must confront the reality that oral health remains underrepresented in the essential benefits package. Currently, only 13% of our facilities offer dental services, limiting reach and impact. This must change if we are to realize equitable health for all, and in the mantra of UHC, leaving no one behind. And it is you to be able to advocate for the change in the benefits package and tariffs so that we can be able to onboard these services that are out of reach of majority of our population. The Kenya Dental Association, in close collaboration with the ministry, is uniquely placed to help bridge this policy and service delivery gap. This includes advocating for a comprehensive oral health benefits package that includes preventive and promotive services. Number two, participating in costing and tariff design through the Social Health Authority benefits package and tariffs advisory panel. Number three, contributing expertise on development of treatment guidelines and quality standards. And finally, supporting data generation and analytics to inform policy updates aligned with real-world disease burdens. There is the selection working group under the Social Health Authority regulations that is supposed to be able to receive inputs regarding the benefits package and thereafter transmit it to the benefits package tariffs advisory panel. Because the selection working group has not been appointed, the ministry has given the liberty to the benefits package tariffs advisory panel to be able to receive presentations of the benefits package that need to be revised to align with the disease burden and the reality on the ground. And I would encourage Mr. President and the executive to work out something that you can be able to present to the benefits package tariffs advisory panel that is domiciled at the University of Nairobi, chaired by eminent scientist, Professor Walter Jaoko, for consideration. We are also investing in regulatory excellence, and that is why Professor is here, to boost our local pharmaceutical and medical manufacturing capacity. Through our regulatory agency, the Pharmacy and Poisons Board, we are in progress towards the achievement of the WHO Maturity Level 3 status. This certification, a globally recognized effort, is a standard for one of the highest performance of any regulatory authority. And achieving maturity level 3 status will unlock global markets for Kenyan-made medical products, support local manufacturers. The Pharmacy and Poisons Board has introduced targeted measures including reduced registration fees and faster evaluations, a dedicated manufacturer support desk, continuous compliance training, and support for good manufacturing practice or GMC upgrades. These steps will strengthen domestic innovation, job creation, and self-sufficiency in health products and technologies. In parallel, the ministry is also leading the rollout of the Kenya Emergency Medical Services, a unified, digitally coordinated ambulance dispatch system and referral system. This system, anchored on our national emergency number and a strong national, county, private sector collaboration, will ensure that all Kenyans can be able to access timely emergency care, including dental emergencies. So we are going to have a central dispatch center at the SHA offices, manned by trained healthcare workers, paramedics, but also supported by qualified medics. And the ambulances will be geo-coded and linked to the emergency facilities, which are our level 4, level 5, and level 6 facilities. SHA will be able to reimburse the ambulance service at 4,500 Kenya shillings within a radius of 25 kilometers. And beyond that, an additional fee of 75 Kenya shillings per kilometer will accrue. This is bringing to fruition what is captured in our constitution, which we have never operationalized since the promulgation of our constitution, Kenya 2010. As I conclude, the Ministry of Health reaffirms its full support for Kenya Dental Association and its partners. Let us deepen our collaboration, strengthen our policies, and reaffirm our collective commitment to quality oral health care. The future of dentistry in Kenya must be technologically enabled, ethically grounded, professionally led, and universally accessible. May your deliberations be fruitful, your partnerships enduring, and your time in Diani both productive, enjoyable, and inspiring. With those very many statements, it's now my honor and pleasure to declare the 42nd Annual KDA Conference officially open. Thank you.